afternoon, Project NICU.
Hi, everybody. Welcome back. It's Amy and Rochelle again. We are really thrilled about this week. I think it's been pretty awesome. Yes,
It's
Amy?
been a fantastic
Everything's,
week. Yes, we've had
everything's
great
run smoothly.
engagement. We've had incredible conversation. It's just been really wonderful.
Yeah. So again, this is our very last day of our 5th annual NICU Mental Health Week. We've heard some really amazing professionals doing absolutely wonderful work out there within the NICU community space, obviously specifically dealing with mental health. We started the week with a really great conversation, which if you missed, we recommend that you go back and watch on our channels.
Yes.
But it was a great conversation with Morgan, the Program Director, Family Centered Care Task Force. Onessa's
Yep,
journaling
Onisa,
session.
her
Onisa,
journaling session yesterday was, or no, 2 days ago, Wednesday, was
Wednesday.
amazing.
Yeah.
Such a great way to implement, that practice for all of us, no matter where we're at on our healing journey. So I found it very therapeutic myself.
Yeah. And actually, for me, it was, Amy and I obviously are graduate NICU parents. We do have the opportunity definitely to engage with and interact with medical professionals, of course, working in the NICU, but it's been really great for us to have so much FaceTime and connection and learn and hear from mental health professionals who are working with parents every day in the NICU. I think a lot of parents have been really encouraged, especially former NICU parents who have been
I
through this
agree. Yes.
and maybe felt like they, didn't have the support that they needed, or they didn't have the acknowledgement or the resources that they needed. So to hear from mental health professionals out there in the space, working with these families every day in the hospital, kind of at ground zero, it's encouraging. I think that, the more that we talk about this every year and other organizations like ours, the more people that share their stories, it just gets better for all of us, moves things forward. And hopefully soon we'll see the day when it's standard of care to have hospital systems, address the mental health of NICU parents specifically.
I think that's why it was so important for us to engage the Family Centered Care Task Force early in the week to kind of set that stage for the medical teams and for parents to know that, these are your rights as a parent. These are the ways that we should be really engaging families in the care for their babies. So I hope that set a tone, across the network.
Yeah. And one of our, obviously Project NICU is dedicated to supporting every family, every parent who experiences the NICU. But something that we also really strive to do as part of our mission is to support and to celebrate all of the NICU medical professionals who hold our hands as parents through the process. We know that they experience their own burnout and secondary trauma. And it's really important that we can talk about them and their experiences and help educate and support them as well. So that's kind of how we wanted to really close this week out.
Yep.
We are absolutely thrilled to introduce and welcome our last speakers for the week. Again, there's no better way to kind of wrap things up than to focus on the medical providers and the professionals within the NICU. So I am absolutely honored to welcome in our last two speakers, Drs. Hinkle Salandi and Dr. Celeste Poe. I will start with Brittany. So Brittany is a licensed clinical psychologist and infant mental health specialist at Cincinnati Children's Hospital Medical Center and assistant professor at University of Cincinnati College of Medicine. She supports families in the neonatal intensive care unit through trauma, postpartum depression, and anxiety, and the overall difficult experience of having an infant in the NICU, which we can certainly understand and appreciate. So thank you, Dr. Hinkle Salandi, for joining. And Dr. Celeste Poe is another licensed clinical psychologist and perinatal mental health specialist with expertise in supporting families through high-risk pregnancies, their NICU stays, and of course, all of the trauma and grief associated with those experiences. She serves as clinical assistant professor in the Department of Psychiatry and Behavioral Sciences at Stanford University School of Medicine, where she directs the NICU psychology program at Lucile Packard Children's Hospital. Thank you both so much for being with us. Your bios are quite impressive, and we are really looking forward to hearing what you have to say. And I think I speak for the entire NICU community when I say thank you. Thank you for your work. You have given everything to this, and we just really appreciate you, and we see you. And so I'll hand it over to you, ladies.
Good morning or good afternoon, everyone. I'm so glad to be here today to talk a little bit more with you all. I will first like to start by saying I am a NICU psychologist, but I am also a NICU godmother. So this like working in the NICU is very personal to me, as well as it being just like a passion for my professional life as well. So I wanted to start by just kind of highlighting how the NICU itself is a stressful environment for everyone involved. Like it is all encompassing stressful for providers, for families, and even for our little infants, right? And not only with that stress, there can also be trauma. There can also be other like mental health challenges that arise, as well as like just a shift in routines for families. And that's kind of where I wanted to start. And I want to I want to give space for Celeste to say hello to everyone as well and share anything that she wanted to share.
Yeah, thank you so much. I didn't know that you were a NICU godmother. I'm also a NICU auntie. I work in the NICU that my nephew was in for a few weeks. It's amazing how much the NICU experience touches lives, and yet, I think it's still so important that we continue to amplify these experiences because I think as a whole, people aren't as familiar with it. And so for families who are expecting to have a baby in the NICU, they might have a certain idea in mind, but I think when you really step into that setting, immediately you get the sense that this is a really high stress environment. I think even as a clinician, when we signed up for this job, entering that setting, I mean, obviously it's an intensive care setting, but seeing what that means, I think realistically is something different. I remember when I first started in that setting, really recognizing that that meant things on a number of levels. I think even just the culture amongst the staff and the feeling that, we take this work really seriously and people are very protective of these little babies. And so you get the sense that people care a lot about the babies and the families, and they're under a lot of pressure. So I think, it is important that we highlight a little bit about what it's like for staff in that environment too.
And I kind of want to add to that too, right? Because like we take our job so seriously and we care a lot for the babies and the families, that ultimately has an impact on us and how we manage the stress that arise, not only for ourselves, but also for the families that we support. So, what I've come across in my work in the NICU is there may be a variety of ways that people may be navigating this high stress environment, whether that's families or even the staff, right? So I know what comes up for me initially is thinking about defense mechanisms because it is so difficult. How can I cope with what's going on? And sometimes that looks like coping through humor or coping through repression and like not addressing what's going on at all. Sometimes there's what I've also noticed is there's some kind of coping with like rationalizing as well. So trying not to be as emotional, but being kind of logical about what's going on. And that seemingly helps some families, right, in the midst of their experience. And then sometimes that boils over, right? So I think what's really important too to talk about navigating this stressful environment is that we have to have some skills, right? Not just for families, but also again the staff. Like what can we do to ensure that we are taking care of ourselves as we're taking care of other people, right? And as we're caring for other people.
Yeah. Yeah, I think that the skills are so important, and oftentimes for providers, you're just kind of expected to know how to navigate that. Obviously, navigate that for your own emotional experience, but also to support families. And so if we're not educating and providing those skills, obviously there is a gap there. But I think also something that I find really interesting, both working with families as well as providers, is sometimes I think the awareness isn't there. I think for a lot of families, again, who experience this as a surprise, it can feel really disorienting if you're not coping the way that you typically cope, if you feel like your emotions are all over the place. And for families, it's a little bit more obvious when they are struggling. For staff, I think that because they're in the setting all day, every day, and for many staff, years, decades even, I think sometimes the awareness is not there where maybe they have developed, like you said, defense mechanisms or coping skills just to get through the day, but aren't maybe necessarily actually helpful for their overall well-being or might actually be impacting the care that they provide. So sometimes I think, again, that education and those skills include just bringing some awareness to the fact that, you know, as providers, of course, we're going to be touched by the work as well. We're not immune to it. And then also recognizing that that can impact our care, obviously. So we should kind of prioritize that as well.
Yeah.
I have something to say. Is that okay? Dr. Poe, when you were just talking about how, parents don't normally react like they may, to another stressful event that they've had in life, just because this can be the first time they've ever encountered something this, I mean, there is no other experience quite like having an infant taken from you through a traumatic birth. Even if it was necessary and you're so grateful for the ability of medicine to intervene in that way, but having your baby taken from you quite literally and then taken to an intensive care unit and the weeks or months that follow, that separation is just so disorienting, right? And we could talk forever about that, but needless to say, I was thinking when you were talking about that, because one of the things that, as an organization of former NICU parents ourselves, that we always make sure to share with other parents who are currently going through it is, listen, there is no right or wrong way to feel. Every day is so different. Every nursing shift change is different. So, you are going to experience this plethora of emotions that can make you look totally just from day to day. I was just thinking about the fact that, for us, that is such luckily a transitional time, though, where we're kind of in this crazy ball of every emotion every day. The staff, though, experiences us as parents just on a rotation for the length of their careers, to your point. I mean, existing and going to work every day with people who are, and hopefully this isn't offensive, but I think any NICU parent would admit it. I mean, we're just like caged animals in so many ways. So to bear witness to that, you don't know when they're going to snap at you, when we're angry at staff, when we cry, when we are numb. That in and of itself has got to be so disorienting, and just like your baseline becomes really weird, right? Your experience of people every day must be really difficult.
Yeah, and to add to that, right? Like, we love what we do, but of course, every day for us also looks different depending on like what's happening within the NICU. So I think even that in itself can kind of leave some people on edge, not knowing what things may look like when they go home and return the next day. Or as you mentioned, not knowing what to expect from the families as well. And I know this is why it is so important to kind of create a space where parents can feel like they can show and express whatever emotion is coming up for them. I mean, of course, in a respectful way, right? But we want there to be a space for parents to be able to be authentic and honest about their experience, because we know that it's a challenging one. And it can be really helpful to communicate that and express that in processing and going through it at the same time, if that makes sense. But then again, right, it may take a lot for staff to build that, right? Depending on what families are coming with, even what their perceptions are about like the medical staff and what they believe that the staff may be thinking about them, right? So it's a lot of back and forth between the staff and the families, but ultimately the communication can be really important in kind of creating a space where it can feel acceptable, but also respectful.
Yeah, I also think a lot about how privileged we are as psychologists to provide that space. I think about this a lot when talking with families who are navigating the ups and downs of the NICU and the ups and downs of their relationships with different staff members. And it feels like an honor to be able to specifically focus on creating a space like that with parents. We don't have any other major responsibilities but to create a space that feels safe for them emotionally to share and kind of express what they're struggling with, which is very different than all other providers. I mean, I think social workers in their amazing roles do a lot of this as well, but they also have a lot of other responsibilities that they're grappling with too. So I think one thing to think about is when we're talking about staff well-being, each staff member has a different relationship with the family. Some staff you'll meet very briefly. Some staff, like bedside nurses, are there with you all day, every day. And so I think that also makes it challenging too, where, having to balance the medical care and also keep in mind the emotional strain that's placed on parents and trying to hold maybe your own nerves around caring for a baby that's critically ill. It's not something that is exactly what we navigate as psychologists. So I also, want to keep in mind too that different providers have different responsibilities and different limitations as far as holding space for families.
Absolutely.
Sorry, I wasn't quick enough on my unmute. Okay, so one of the things that parents ask us a lot, just as an organization, they're like, listen, the staff made such a huge difference in my life. They were like family. We spent, 5 months with them, whatever the case may be. And the nurses, the doctors, the people at the bedside, the social workers, even, the sweet lady who buzzes you into those doors every day or helps you print out your visitor's badge or whatever, right? Like these people become so important to us and such fixtures of our lives. And then you go home and you can't stop thinking about them. And you don't know if you were ever really able to tell them how much they meant to you. And I know for me personally, and lots of other parents that I speak with, especially those I'm the closest to, my friends, it was such an important part of our healing journey to be able to go back to the NICU or even just make a drop-off delivery if you don't feel comfortable walking back into the unit after everything. But being able to drop off a little gift basket or a card that your family signs, something like that. And a lot of parents hesitate. They're like, I don't know if they really care or if it matters. What do you have to say about that? How can we as parents help to support the mental health of these people who made such a difference without feeling, should we feel weird about it? And what are your recommendations? Like, how can we show them?
That's such a great question. I think that speaking to, in my experience, the hesitation around showing that you were grateful is a little bit more rare in terms of like the feeling uncomfortable with it or wondering, did they even care? I just want to normalize that too, because I can recognize that for families, again, this is a specific moment in their life that feels very stressful. And I can understand why you think, well, this is just their job. This is what they do every day. And they see you in a very vulnerable state. So sometimes going back afterward can feel a little stressful, but I definitely think that families should do whatever that they need to do for themselves to cope with that situation. If that means that you need to leave that experience behind and that's what your family needs or coming back, absolutely encouraged to do that. I know a lot of NICUs have like graduation yearly or some sort of kind of event, and definitely encourage parents to do that. But I also talk with families a lot before discharge comes. I know sometimes we don't know exactly when discharge is happening, but we start weeks early talking about the anticipatory grief of going home, because a lot is focused on anxiety taking your baby home for the first time from the NICU, but there's also grief in that, oftentimes you did form close relationships with staff and all of a sudden that's cut off and it feels like, am I allowed to contact them? Am I allowed to send pictures? So we start to process that early, but I think finding ways that you can still feel connected is important. We have families that send email updates, that share pictures. I have families that have shared pictures years later, and they're always welcome. And I appreciate that so much. It's always a really nice, I can speak personally, it's always a really nice reminder about the work that we do, the importance, but also that there is a story after leaving the NICU, that we get to see your kids grow up. I find it, yeah, just really rewarding.
It's a tough gig that you all have in so many ways, right? Because the whole point is to work yourself out of a job, and then you never often get to see, the fruits of your labor and, the story that continued on for this family and for this child, right? Like those first day of kindergarten photos or whatever. Yeah. So I'm getting a little message over here in our chat. We have a lot of medical providers who are logged in today listening, which is wonderful. That's what we were hoping for. What are some coping tools or exercises that you guys might be able to provide as just little ways to help them work through the trauma and stress that they encounter each day? Do you ladies have any tips or suggestions there?
I think the first thing that comes to mind for me is deep breathing, right? Because it is a skill that we can do just about anywhere. And people may not even know that you're doing it. And there are oftentimes during the day, right, that we may need to just sigh or take a deep breath. Right. So, being that we breathe naturally, if we take a moment to just kind of focus on it a little bit more, we allow ourselves to kind of calm our nervous system a bit too, and kind of get back to a baseline, or maybe not even our baseline, maybe just lower than where we were at that moment when we started. So I think deep breathing is also just a really nice tool for like moving forward, but also kind of coping through trauma and stress.
Yes, that is my number one that I use personally. I actually was just talking with some colleagues about this recently, and I think one of the biggest things, connecting it back to the lack of awareness when you do this work every day, is the power in pausing throughout your day. I know, especially with different providers, time is very limited in terms of self-care and being able to care for yourself after a really difficult conversation or a really difficult procedure. And so developing mechanisms where you can pause even for 20 seconds to acknowledge what is happening for you. So sometimes we have feelings of distress that come up in our body that we don't have language for. We just know we're feeling something. And I think pausing and trying to describe it, trying to locate it in the body, trying to acknowledge, oh, this is because of that conversation I had with that parent, or this is because of, that email that I just saw. Really connecting it and kind of acknowledging it is a nice way to just bear witness to it, because I think the thing that happens when we're very, very busy and going from one thing to the next is we start to shove that under the rug. And under the rug, there's a lot of stuff under there, and that starts to weigh on us over time. That starts to carry over when you go home after work. And so I think really finding ways to remind yourself to do that. For me, it's actually the deep breathing. When I'm leaving one room and going to the next, or one meeting and going to the next, I do a natural like deep breath sigh, just kind of letting go of whatever came up in that particular meeting or conversation.
I kind of want to add another one here that I think goes well with the ones that we are discussing, or kind of aligns. And it may be talking to another trusted member on your team or a colleague, right? Because I know personally, if I have had a really hard care conference, right, that I'm leaving, and of course I'm supporting the family, but when I leave, I may call another psychologist on my team and ask, is it okay if I vent? And then kind of talk about what happened for me and how I'm feeling. And then do all of those other things like pausing and taking deep breaths, right? So I think it just depends. And, I think it's important to also ask your team member for permission, but using that space that you have in your colleague to also talk about your experience.
Yeah, I think connected to that, I think it's also really leaning on our interdisciplinary team to support our families when there are really heavy cases or really difficult decisions and things like that. Again, different members of the team might have a different sense of responsibility with that particular case, but we are an interdisciplinary setting, and there are a lot of different providers that play really important roles for supporting these babies and these families, and not forgetting that it's not completely all on your shoulders, leaning on the supports that you have. I know that not all NICUs have psychologists or mental health providers available, but we're here also to support staff and to support the family and help all of our team members feel like they're a part of a team and they don't have to, shoulder all of this on their own.
A lot of my mom is a pediatric nurse, and while she does not work in the NICU, she's certainly sat bedside and worked with lots and lots of grieving families in pain and who are scared, and many of the same sentiments that I can certainly identify with as a former NICU parent. And she said something super wise a long time ago, just like how we always try and tell NICU parents, listen, you're the most important member of your baby's care team. You are the greatest asset to your baby. It's not about you being weak or, I don't want to worry about me right now. It's all about the baby. I'll be fine. Well, sort of. Like, in order to give your baby the best chance possible, in order to show up as your best self and advocate strongly and ask medical questions and to just be there for your baby, you have to make sure that you don't get sick. You have to make sure that you're eating food and drinking water and sleeping and changing your clothes, and looking at it as another avenue with which to do something within your control, where many things aren't in your control in the NICU, to be able to, again, show up as your best self. So I think for providers, I would imagine that it's a lot of the same deal, right? You can't show up as your best self and this is really hard, important work. Every single staff member, every nurse, everybody. So this is just a way of them really committing to their craft and their profession and showing up as their best selves for families by honoring how important they physically are and their mental health and their bodies. Taking good care of yourselves means you can take better care of families, right?
Yeah, absolutely. It's such a parallel. It really is with what we share with parents, that we need to be doing the same thing ourselves. I think that some of the tools we develop to sustain ourselves in the work, like I mentioned earlier, sometimes are less helpful than others. I think one of those things is sort of pushing down our humanity. And I think that over time really weighs on you as a provider, feeling like you have to show up sort of in this perfect way, or professional way, or whatever it is that you think you need to sort of do, the armor that you sort of put on to go into work. It really doesn't allow us to tap into our needs personally, just as human beings, that we do have weaknesses, we do have feelings, we do have things that hurt us. And I think bringing that into the work and allowing yourself to have room for that, while also still being, clinically excellent and really good at your job, is really important. And I don't know that in medicine, we always do a good job of inviting healthcare workers to bring that part of themselves into the work.
Do you think there's a stigma within the workplace when, a staff member says, I'm really struggling, right? When a baby passes or just a rough day? Do you think there's a stigma that still exists if someone raises their hand and says, oh, I'm struggling, that they might be singled out? Or I'm just wondering what kind of the atmosphere is overall in the space.
I don't know if I would say there's a stigma versus even how thinking about how we're even trained for some of these positions and what that look like. We're expected through learning and as students to continue and to go and push through, right? So it can be really hard to transition to being in your career and feeling like, wait, I do also need to take care of myself when you've been taught to push through, right? So I think it kind of goes back to the way that we learn to navigate initially, and then not having that flip or switch in our routine. So then it can be harder to express some of those negative feelings or some of that stress or burnout or whatever is coming up.
Yeah. If you have a just within your prospective hospitals where you ladies work. And if there's a staff member, again, whether it be a nurse or whoever who's working with families, and they're struggling, they can't quite put their finger on exactly what it is, right? In order to, we wish everyone, I'm sure you wish everyone could walk up to you and say, yeah, I'm experiencing depression with these features, and right now it'd all be great. But even if they're just getting that inkling, they're not sleeping well, they feel really triggered, they're just not themselves. Where should they start? Like, what would you suggest? Where should they begin to think about if they may need some sort of professional support?
So one thing I was going to add a little bit earlier is that I think it's so dependent on the unit culture, and that is different at every single hospital. And it's also different by discipline in terms of leadership. And do you feel like you can go to leadership to express some of this? So I can't speak generally, but I think it's important to know what your resources are at the hospital. Many hospitals have hospital-wide supports. So if you feel like you can't share that with a colleague or with your leadership, and you don't have a mental health professional on your team, or you're feeling a little uncomfortable sharing that with a colleague, then looking into outside resources that are available to you. There's also a lot of online support specifically for healthcare providers because we recognize that this is, working in intensive care is really challenging. But I would say outside of that, if you do have trusted members on the team, it doesn't have to be a mental health professional, but if you feel like there is a trusted fellow nurse, or if you're a neonatology fellow and you feel like your training director is someone that you can share that with, that can be a nice start so that they can help you get connected to the resources. We certainly tell our staff at our hospital, you can talk to us. You can catch me, in the halls. You can message me. I will say that I don't get a lot of people taking me up on that. And so I do think that there's still this sense, I don't know if stigma is the right word, but there is a barrier, I think, where people don't feel as comfortable tapping into that in the work environment. So I definitely like to make sure people know what their resources are that they can reach out to outside the hospital. But I definitely welcome those conversations if I can be helpful to other staff.
Yeah. You ladies are wonderful. You're a wealth of knowledge. We genuinely, the most important thing, obviously, is making sure that people who are listening in today, throughout the week, that they just really feel normalized, I think. The whole, again, people say it all the time, but like, it's okay not to be okay. Well, it's not okay, and we should do something about that. But you're right. It is normal in an environment. The NICU is not a normal place. Mm-hmm. It is it's kind of bizarre, right? And so to be a provider where you live in that chaotic, traumatic, isolated kind of place where only if you step foot there do you really ever understand it, and then to transition into the regular life and, run into CVS to grab your body wash and pick up dinner and go home and just expect it to be regular. It's a really tall order. So, just thank you both so much for being here today and for sharing of yourselves. We know you're busy and your perspective is really, really important. We hope everybody who's been listening in, especially those medical providers who are listening in, that you feel supported, seen, acknowledged. It's not you, it's just the situation. Nothing's wrong with you if you struggle, right? You're normal, just like we tell parents, and there's a place for you here. Yeah. Thank you so much. I cannot believe this was our 5th annual NICU Mental Health Week. It's kind of wild, but we plan to continue the conversation surrounding the mental health of our community members. So everybody within the NICU ecosystem, parent, provider, this will be a conversation we continue for years to come. We will have a full, fresh schedule out within just a few days for the June virtual support group schedule. So definitely check that out. I think, there's been some buzz, especially this week, as we've heard more from providers and people working in the units like yourselves to beef up that peer support element for providers. And maybe that means, a lunch hour virtual support group, lunch chat for NICU nurses or what have you. So stay tuned. We'll definitely, be sure to share and poll the community, because we want to hear from all of you. What would you be interested in learning more about after this week, and what other support opportunities are you interested in? So thank you so, so much. We appreciate you, ladies. You're wonderful. Keep doing what you're doing. And from all of us, thank you for what you do and what you see and what you endure every day within this community. The ripple effects are certainly felt. So thank you.
Thank you so much for having us.
Yeah. All right, everyone. Take good care out there.